The way I like to begin the class is to show you a film clip of a patient using this at the main medical center. You'll see June King, who's about to have a mastectomy and 5 hours of breast reconstruction. Her surgeon is Dr. Dixie Mills, who's used this program for probably more than 5 years. What's amazing about this film clip is that there June is in the holding area, and she says, you'll hear her say the words, "I feel overwhelmed by love." That's the blanket of love that she's feeling. What an amazing way to go into surgery. You'll also notice that in the operating room, the whole staff say the healing statements. They actually overdo it for the TV cameras. They really need just to have one person quietly, just gently whispering them into the patient's ear. So get comfortable and we're all set to begin.
When we are faced with a health crisis, we can call upon our intuitive knowing to enhance our natural healing abilities.
I saw that when clients would come to me with a health crisis, that if I'd show them how to get deeply relaxed, they would connect with a sense of inner knowing, that hear an inner voice that would tell them their healing process. And if I could get them to follow the inner voice, that was the work, they would heal. I'm going to count from 1 to 3. And at the count of 3, imagine your healing process and your ideal recovery.
When I got the diagnosis that I had breast cancer, I knew that it was serious, and I knew that I was going to have to make some real serious choices in my life.
You're fine, you're fully recovered.
I decided to have breast reconstruction along with the mastectomy. It would mean I was going to have 6 to 7 hours of surgery.
And feel now how you'd feel, knowing that you're recovered and well and fine. Surgery brings up old emotional issues that haven't been resolved. It's also the fear of death, the fear of dying. It's a very, very vulnerable time. And so I find if people can talk to the part of their body that's having surgery and find what are the emotions that are stored there, and that comes through your intuition, that in fact, as those emotions come to the surface and are released, they heal much faster.
Any last-minute questions?
I'll send them whatever.
No.
Everything's gonna go fine. Yeah.
That's my belief. Why don't we just kind of
All circle around?
Yeah,
Sure.
and Peggy, could you just kind of lead everyone?
Yes, yes. Just close your eyes and just let your mind go back to the time you felt your love for June and her love for you.
During that time I was waiting for surgery, I was overwhelmed with a feeling of love and peace that I've never experienced before.
That was last Wednesday, and we got to talk.
It was wonderful working with June. As she listened to the tape, she connected with a deep love, the love she has for her grandson, and she began to anchor to that love.
Normally people would be concerned about surgery and have fear and have anxiety, but I had none of that.
Okay, this is going to be your home for the
Next 4 or
afternoon.
5 hours.
Yeah, it's not real cozy, but we'll try to make it not too bad.
Let me go again.
Following this operation, you will feel comfortable and you will heal very well. Again. Following this operation, you will feel comfortable and you will heal.
It first makes her very peaceful before surgery, which means that her parasympathetic nervous system is the dominant one. It means her muscles are relaxed. If a person's tense and terrified, their muscles, their skeletal muscles stay really rigid, and the surgeon's knife has to cut through that. The muscles never relax. So it makes surgery easier. It also strengthens her immune system, and you'll see it's going to cause her to have much less pain following surgery, and she's going to heal much, much faster.
My recovery time was very quick. The morning after my surgery, I was combing my hair, and the nurse came in and she said, she was very concerned, asked me what I was doing, and I said, I'm combing my hair. And she said that I wasn't supposed to be able to do that. I wasn't supposed to be able to lift my arm, but I was doing it and it wasn't a problem. It's really important to feel as comfortable as you can when you're having something that serious going on in your life. I was able to verbalize my needs to my physicians. I was very fortunate that my physicians were able to hear me and to work with me to make me feel comfortable and safe.